Yeah, what was that about? I wanted to watch, I just didn't have time.
It's just one of those press conferences. The answer is good though, because he's kind of the opposite of that. It's all about. But it was funny because they were asked about county jail, and after he answered the question, we're saying it's like, and we've tested more in our jail than Montgomery County has. I'm like, man,
How many do you have in your jail then? Do you have secret prisoners?
400 something. I think her point was they test them more frequently because I think they're testing everyone who comes in gets tested.
It's kind of like what I said, just anyone No, I really enjoyed hearing the different comments, what the difference was between that and that. Especially since they screened questions. There's a lot that's wrong on that call.
It was a whole different thing.
Oh, go straight to the ER. No.
Oh, you bet.
She tried to, or was that the sister? I tried to clear it. Some one at the end.
Is that the
said
secret of
like
sisters?
13
Like, why
questions.
do this? I've said that.
You know
Said
it's
that.
funny.
That's the
Said
I
that.
Googled them when he said their names. And I was like, they look a lot alike.
Or Dr. Lewin at Mansion Corner.
And he said they were fine, but then someone else who was texting me said they're going to find doctors. I didn't hear him say doctors. I just started saying they're both fine.
There was a lot that was wrong.
So you're a resident right here. Where are you?
Now he's making sure.
Good? Everybody good? Okay, great. Good afternoon, everybody. Today is Thursday, April the 30th. I'm Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here with my colleagues, Commissioner Ken Lawrence and Commissioner Joe Gale, Dr. Brenda Weiss, the Administrator for our Office of Public Health, and Dr. Al Wang, Regional EMS Director. So since our briefing yesterday, we have an additional 159 new positive cases of COVID-19 in Montgomery County. Within that 159 are 5 inmates from the Montgomery County Correctional Facility. These positive individuals are from 37 municipalities, none of which are reporting new cases today. So this keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 1 month old to 98 years old. And you can, as always, check our map at montcopa.org/COVID-19 for an update of the ages and the locations of these individuals. In this group, we have 84 females, 74 males, and 1 that we do not have information on. We know that 8 are hospitalized, and we know that 6 are in isolation at home or in a residence, and that 145 we do not have information on. I am also saddened to confirm that 31 more Montgomery County residents have lost their lives to COVID-19, which brings us to 275 deaths confirmed positive from COVID-19. 14 individuals died at a hospital, 13 passed away at a home or residence, and 4 we don't have information on. They ranged in age from 59 years old to 96 years old. Overall, 143 females and 132 males have lost their lives to COVID-19. 12 have self-identified as Asian, 2 Asian Indian, 3 Asian Korean, 28 African American or Black, 89 white, and 141 unknown. Now, in terms of probable deaths, and remember, these are individuals who have COVID-19 listed as the likely cause of death on their death certificate, but have not yet been confirmed by a lab test. Some probable individuals do move to confirmed positive if we get a lab test back, and then some just were never tested, and so we will never know, we'll never have them listed as a confirmed positive. So today we have 145 total probable deaths. So adding the probable deaths to the confirmed positive, that gives us a total of 420. Our hospital beds continue to be fairly well utilized. We have, again, around 400 COVID-19 patients in our Montgomery County hospitals. And this number is going up and down a little bit from day to day. It goes down one day, goes back up the next. So we're staying right around 400. We have not seen any substantial or prolonged decrease in hospital utilization of patients with COVID-19. In terms of our long-term care facilities, we continue to have 90 facilities that are reporting positive cases of COVID-19 among their staff and residents. As of today, we have the report of 1,114 cases among residents and 449 among staff, bringing us to a total of 1,563 individuals that are considered positive for COVID-19. My daily reminder, not all of these individuals are Montgomery County residents. So the numbers that I just gave you do not necessarily or are not necessarily part of that total confirmed official count for our county. But we do track this separately as just a snapshot in time of the very serious and challenging situation that is being faced at a number of our long-term care facilities. And again, we do want to thank those workers at these facilities who are working very hard to keep these residents safe, and we do very much appreciate everything that they're doing. So in terms of deaths of Montgomery County residents related to long-term care facilities, of our 275 confirmed positive deaths, we have 230 that are confirmed positive Montgomery County residents from a long-term care facility. This brings us to 83.6% of our total confirmed positive deaths. We have an additional 112 probable deaths from residents of long-term care facilities that are also Montgomery County residents. We continue to do outreach to these facilities. Our FAST team, which stands for Field Assessment and Support Team, it has completed 27 visits by the end of the day yesterday, and today they are debriefing on what they've learned at these facilities and working on guidance and recommendations for these facilities. Tomorrow they plan to go out to visit a number of additional facilities. I don't have that number yet, but we'll be happy to share that with you tomorrow. The update from the Montgomery County Correctional Facility is that things are stable. Of the 171 inmates who tested positive for COVID-19 and who are in isolation, as of noon today, all remained asymptomatic. As you know, there's a little bit of weather out there today, and both of our testing sites are closed. The Montgomery County Community College drive-through testing site is planning to be open tomorrow, and we are waiting to get confirmation from the Norristown walk-up site, but we hope and expect that they will be open tomorrow. So let me just review how to make appointments at either place. Appointments for Norristown, which are for Norristown residents only, will open up tomorrow morning at 8:30 a.m. by calling 610-592-0680. And as a reminder, that is for Norristown residents only. 610-592-0680. For anyone else, you can go online starting at 8 a.m. tomorrow morning at moncopa.org/COVID-19. Click under the green County Testing Information button, and you can make an appointment that way. If you don't have good internet access or an email address, you can call 610-631-3000 starting at 8 a.m. tomorrow morning and make an appointment by phone. I just want to note that today is the final day of World Immunization Week. We have a beautiful little graphic over here acknowledging this week. Today is the final day, and this week aims to promote the use of vaccines to protect people of all ages against disease. While we don't yet have a vaccine for COVID-19, immunization against other diseases saves millions of lives every year, and vaccines are widely recognized as one of the world's most successful and cost-effective health interventions. If you think that skipping a vaccine puts only yourself at risk, please think again. Getting vaccinated also protects those in our community who cannot receive vaccinations, such as individuals who are immunocompromised. They depend on the rest of us being vaccinated to prevent the spread of disease. Even during this pandemic, please make sure you check with your healthcare provider and parents with your children's provider in order to stay on schedule with necessary vaccinations so that you can keep yourself, your children, and our community healthy. Particularly for children, many pediatricians are still finding ways to administer vaccines. It's so important for children that they get their recommended series of vaccines. So don't hesitate to check with your child's healthcare provider. I'd like to recognize and thank everyone involved in the immunization process, from the scientists who develop vaccines, especially those working around the world right now to develop a vaccination for COVID-19, to the nurses who administer them, and to each and every one of you who rolls up your sleeve and gets a shot to keep us all safe. So a couple more words about social distancing. We know that everyone out there has made an enormous number of personal sacrifices, and we want to thank you for that. And because of what you have done, we have flattened the curve here in Montgomery County. And if we all keep at it, there is a light at the end of the tunnel. Now we need to learn how to live with this virus until there is a proven treatment or a vaccine. What does living with this virus look like? We need to safely restore economic activity and safely get as many people back to work as possible. We need to safely reopen childcare so parents can get back to work. And hopefully, we will be safely reopening our schools this fall. And while we do that, we need to continue to protect our essential workers, our first responders, hospitals and hospital workers. This includes hospitals being able to safely resume elective surgery, hospital workers having enough PPE to use it as they would normally. Hospitals need to have more COVID-19 patients being discharged than admitted. And this includes being sure that when you call 911 for any health emergency, a first responder will be able to pick you up and there will be a hospital bed waiting for you on the other end of that ride. So how do we get there? Well, looking at our current data, including hospital utilization, we believe we continue to be at a plateau. But we must work to get our numbers lower and avoid a rapid upswing in those numbers as things open up. We should think of where we are now as our ceiling. We must be lower than where we are now and certainly never above it. We have some time before we will reach the governor's target for moving us into the yellow phase. Let's use this time wisely. Each of us needs to think about what steps we can take in our personal lives and in our work lives to learn to live with social distancing. Social distancing needs to become second nature and socially expected, in the same way that hugging an old friend you haven't seen in a while used to be. If you're a parent of school-aged children, think about reaching out to your school to talk about summer learning opportunities. Also, start to talk with your kids about the things they need to think about to keep themselves safe once it's allowed for them to see their friends again. If you are an employee that isn't working or has been working from home, think about what your employer could do to make your workplace safer and share those ideas with your boss. We need more testing, particularly the rapid virus testing. The county is actively working to significantly expand our contact tracing team. The county is actively evaluating options to provide additional financial support to our small business community and our safety net and nonprofit organizations, both of which have been deeply impacted by this epidemic. Together, we're sharing a tough spring. Weddings, graduations, including the high school graduation of my twins, religious celebrations, and baseball games have all been canceled. We can't go to the gym, get our hair cut, or go out to dinner. But we will get through this if we each do everything that we can to be part of the solution. If we all follow data-driven recommendations and evidence-based solutions, we will beat this thing. For now, you must continue to stay at home. But use this time wisely. Make your plan. We are all in this together. And if we each commit to doing our part, we will be able to get back to doing so many of the things that we love. But here's the deal. One person alone can't solve this, but it only takes one person to really screw this up. And as a reminder, I shared this with you, a graphic you haven't seen for quite a while yet. But I just want to remind you that that red dot in the middle is one person. And that person caused all those other people to be infected and all the people in green to be directly exposed and have to go into quarantine for 2 weeks. Folks, that is just one person. Please, don't be that person. Don't screw this up. Thank you. With that, I'll bring up Commissioner Lawrence.
Good afternoon. I'm Commissioner Ken Lawrence, and today I'd like to give an update on our Montco, PA COVID-19 Response Fund. This fund was established on March 26th and is being administered by the Montgomery County Foundation. As we end the month of April, $512,000 has been raised or committed for the fund. $65,000 of that has been raised from individual citizens. So I'd like to thank all of our local foundations, businesses, and private citizens who have contributed. As of today, 91 local safety net organizations and first responders have been awarded $290,000. This is a community-wide effort to support the immediate needs of residents hardest hit by the pandemic. Grants of up to $5,000 are being reviewed and processed on a rolling basis. Projects are prioritized based on the geography they serve, the capacity to meet the higher demand for services, and whether the project targets particularly vulnerable populations. Grantees so far have included food pantries, senior care programs, rent and utility payment programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, protective personal equipment purchases for nonprofits who are continuing essential in-person services, and emergency shelters. But more funds are urgently needed to support the ongoing efforts of our first responders and our social safety net providers. So if you have the capacity and you're able to support the need and high demand for grant requests, you can make a tax-deductible donation, and you can find more information at our website, www.montcopa.org/COVID-19. And safety net organizations and first responders can apply for grants there as well. And for whoever is interested, you can see a full list of grantees on the website. And with that, I'll turn it over to Commissioner Joe Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. Most of you are aware of the community-based testing site at the Montgomery County Community College in Bluebell, which is organized and operated by the National Guard in conjunction with our Montgomery County Department of Public Safety. This week, a private sector company now has a testing site open in East Norton Township here in Montgomery County. Patient First Medical Center is now providing drive-up COVID-19 testing at their office located at 400 East Germantown Pike in East Norton, which is open 7 days per week. However, testing will be conducted by appointment only, and Patient First Medical Center is scheduling up to 48 tests per day. To qualify for testing, a patient must meet the CDC requirement of having symptoms such as a fever, cough, shortness of breath, or being a high-risk profession such as a first responder or healthcare worker. Appointments can be made by calling the Patient First Medical Center at 610-994-0063 or going to their website, patientfirst.com/COVID-19-testing. For patients who have medical insurance, there is no out-of-pocket expense for coronavirus testing, and the visit will and the visit will be billed to your insurance company. For self-pay patients, there is a cost of $90 per test. Our local county newspaper, the Times-Herald, did a detailed story about Patient First Medical Center today and is helping inform the public about this option. Patient First is an early and local example of what we should expect to see more of nationally. Earlier this week, President Trump explained that testing will increasingly be conducted through private sector companies rather than such a heavy reliance on government-run testing sites. Recently, we saw that large national drugstore chains such as CVS and Walgreens have announced their plans to open thousands of testing sites across our country. And with that, I'll turn it back to Commissioner Arkush.
Any questions?
What's the timing for reporting of deaths? The number you reported today is a big number. Is that, do you have an idea what the time frame of that is?
A number of days, probably anywhere from 24 hours to 3 or 4 days ago, maybe even 5. They come in when they come in.
So do you read anything into it, or is it, I mean, I guess, like you've been saying, kind of take the average of...
Yeah, I don't read anything, and we're not seeing that this is a particular spike necessarily. I think it's just more the timing of when the deaths came in. The question was, do I read anything into this certainly larger than we've reported number of deaths today? And the answer is no. I think it's just a timing issue.
You've said it's all a puzzle, you know, the average number of new cases and all those things. How weighted or how big of a puzzle piece should cases and deaths in long-term care facilities be? Is it they're not community spread as much? I mean, obviously staff members going in and out, but it's more of an isolated environment. Do you separate them out when you kind of factor in cases and deaths, or is it all one big?
The question is, which I'm going to distill down to, how do we think about the numbers coming from the long-term care facilities in the big picture of kind of how we're doing and where we're at? Is that accurate?
Okay. And I know we're far away from lifting the restrictions, but
yeah.
when we were thinking about them, how weighted should those cases be in those facilities?
Yeah. So, and the other part of the question was, as we think about opening up, how weighted should those numbers be? So there's really two separate questions there. In terms of how the governor and the Pennsylvania Department of Health might consider these actual individuals in terms of our count, I don't have an answer to that yet. We are actually hoping to schedule a call early next week to discuss this very issue. I'm sure it's going to take them some time to consider that, so I don't know when I'll have an answer. But we are raising that as an issue. However, I do want to remind everyone that's listening that our long-term care facilities are very challenging environments. They are populated by very vulnerable individuals, many of whom have serious underlying medical conditions and need some pretty hands-on care, sometimes for something as simple as eating. There are other people in long-term care facilities who are there for some temporary condition. Maybe they're recovering from a stroke or something like that. So the population in a long-term care facility is quite varied. And while some may spend their last days there, others fully intend to go home. So it's a real mixture of individuals. Additionally, we have staff there that are going home every day to their families. There's also some staff that go between facilities. So we do have to look at this in the whole picture. The numbers are quite relevant to our total because individuals at long-term care facilities do go to the hospital. The staff certainly goes home, and so they do have to be counted. It's not as if they are hermetically sealed in some place that has no impact on those of us who don't happen to live in long-term care facilities. So these are our grandparents, our parents, our siblings. These are real people, folks, and they are all part of our community. And we should be counting them as we count everyone else. And remember that the folks that are working there are really in a very difficult situation, having to provide very hands-on care to very vulnerable people. So I hope we can all find it in our hearts to be bigger than just the numbers. And we'll look at the numbers and see how that factors in. But I'm increasingly concerned with the people who continue to comment that somehow these people don't count. They do count. and they absolutely have an impact on our entire community. And, let's just be bigger than that, folks. Seriously.
Any concern that we have about a 30% increase of cases in long-term care facilities than Philadelphia? Do we just have more facilities? They're running at about a 56% infection rate. We seem to be running a little higher. Is there?
So the question is, at least looking at whatever, so the question is, Philadelphia nursing homes seem to be running at a lower infection rate than we are. So I have absolutely no idea what's going on in Philly. I haven't looked at their numbers, so I don't know how they're presenting that data, and if it's an apples-to-apples comparison. I honestly just don't know.
I didn't know if we
but
had more
I
facilities.
will say we have a lot of facilities in Montgomery County. And on a per capita basis, it's possible that we do have more beds, long-term care facility beds in Montgomery County than we do in Philly. I don't know. We could try to figure that out for tomorrow and get you an answer on that. We're also working really hard to get data out of these facilities. So I mentioned, 3 weeks ago, I think maybe it was longer at this point, that we started calling them every day and asking them to self-report what was going on in their facility. We had some concerns because certain facilities seem to be calling 911 quite a bit more than usual, and that sort of raised the issue in our first responder community of whether or not there was some issues at some of these particular places. So we started calling, we started asking them to self-report. So we often have data about them before it's in the PA-NED system, which is the official reporting system, because we're trying to keep a close eye on it. We're now actually, as I've mentioned, we formed these teams that's going out and actually visiting these places. So again, we're getting more data. So it could just be a reporting phenomenon, just because we're keeping such a close eye on them, that's different. So.
And to clarify what I was asking, not saying that these cases aren't tragic, that these aren't human beings, but more when you're looking at how things are spreading in the community. And at the rough numbers, it's 77% of the probables, and I think you said, I don't remember the exact percentage, but a large majority is in the long-term care facilities. Does that mean I'm trying to figure out how to phrase this properly to get the question across. Does that mean it's less of a spread in the community because most of these are happening in long-term care facilities? And can you factor that into the decision to reopen, saying, well, at least it's not community spreading as quickly? Mm-hmm. Those numbers are, I don't want to say inflating, but you know what I mean, that those numbers are in an environment that's different than where we're living in the community. Mm-hmm.
So
that's what I was trying to
the question is, when it comes to thinking about community spread and the numbers of individuals who are in long-term care facilities who are becoming ill, how does that influence our thinking about community spread outside of the long-term care facility setting? Fair?
And not to diminish the
right, not to diminish the value of the individuals in the care facility. So what I would say is this: when it comes to lives lost to COVID-19, no question, the long-term care community is being much more highly impacted. I think, though, that is just a function of an average older age in the long-term care community. And almost by definition, if you are there, there's a high likelihood that you also have serious underlying medical conditions that would prevent you from living on your own at home. So they are the population of individuals who you would expect to see have the most serious consequences of COVID-19. But we have to remember that it's not just about the individuals living there, it's also about the staff that work there. And it's staff of all types, and it's staff whose job it is to provide services at different long-term care facilities. And I just want to remind you, one person can have a pretty darn big impact in our community. So we can't just discount the fact that there's a lot of cases within the facility. It's bigger than that. It also includes the potential impact on what we might think of as just sort of regular community spread by all the individuals that provide services there. Yeah. Teresa? Yeah. Nothing? Deanna? Nothing? Everybody's good?
Uh,
You've got one,
and-
you've got one more?
Yeah, well, just to kind of what Joe had mentioned about President Trump saying that there's going to be more of a reliance on private companies providing the testing. Do you have an opinion on that? Do you have thoughts on, is it better to have, could private companies do it better? Do you think public government testing could be done better? Do you have any thoughts?
You know, I think we need more testing. And I want to make sure that that testing has the least amount of barriers for every person that needs it. And so one of the beauties of our testing that the county's been working with the federal government to provide is that it does not require any kind of a provider prescription. You don't have to have a doctor or nurse practitioner who has to see you and evaluate you to get a prescription. You can just say, I need to be tested, I have these symptoms, or I'm this type of worker, or I've had exposure, and it doesn't cost anything. And I am very concerned to hear prices like $90. There are so many people in our community who cannot afford $90 for this test. And this test is so critical right now that I support the least amount of barriers. I mean, frankly, there shouldn't be any barriers to anyone getting this testing. So, you know, with that caveat, I don't mind who's doing the testing, but the barriers, there just can't be barriers, because that often means the people that need it the most are not able to be tested. Yeah. Okay, great. We will see you tomorrow. Thank you.